If you work in public health and you're carrying the workload of what should be 3 people, if you're feeling overwhelmed, exhausted, stretched thin, you're not alone. And also, you don't have to quit your job to feel better. In this video, I'm going to teach you 4 simple, hear me when I say simple, practical tips you can implement right away and start using to reduce your overwhelm. Even if your workload gets heavier, even if public health policy gets crazier, these tips are going to help you stay calm and stay grounded. If that sounds good to you, stick around. Hi, friends. Welcome back. If you're new here, welcome. My name's Marissa McCool, also known as the Public Health Burnout Coach. And as some of you know, I hit burnout working in public health in 2017 after almost a decade in public health. I was hit hard. I was chronically overwhelmed and exhausted. I probably wouldn't have called it burnout because no one was really talking about that then. But man, I was working late. I was skipping my lunches. I wasn't able to make my workout classes. I was eating takeout. I was short and reactive to everyone around me. If you're in that place, nothing's wrong with you. I've been there, but I've also gotten out of it. And not because I'm a special snowflake, because I learned systems, tools, and tips to help me do that. Ones that I teach the women in my coaching program now. And I'm going to teach you 4 of those here today. These 4 tips I've taught hundreds of times to the women in my coaching program. And in 3 months or less, women that I work with reduce their stress by 25% and stop working nights and weekends by 50%. That's how I know that this is possible for you too. First, I just want to say, if you clicked on this video, I know that doesn't just mean you work in public health. That means you care deeply about public health. You're passionate about it. But as you've learned, whether it's been over your 30-year career or 5 years since you finished grad school, our public health workforce is really not designed to support our whole well-being. And you're here because you're struggling. Maybe you're more like a duck on water where on the surface, everyone else thinks you have it together. But under the surface, you're freaking out. Those legs are a-kicking. That was me. Everyone thought I had it together, but I was drowning. If that's you, we're going to start changing that today. So let's get into it. First, let's define what overwhelm is. Number 1, overwhelm is an emotion we feel. It's an emotion similar to anxiety or dread or happiness or joy. Not that it feels similar, but it is on the emotional spectrum. Emotions are sensations we feel in our body. And when we're feeling overwhelmed, that is a signal that our brain is trying to tell us, hey, there's too much here. I don't have enough capacity to handle this. Whether it's our workload, our to-do lists, our staff, our emotional experience, our stress. Now, you already know the million reasons that public health can create overwhelm. Unrealistic expectations and deadlines, emergency policy shifts, high turnover, a lack of funding. I could go on and on and on. There's lots of challenges in our field. Overwhelm, if you're feeling overwhelmed, doesn't mean you're weak. It just means you work in a field that has lots of challenges and is really not designed to help you navigate those without stress. But don't worry, don't feel deflated, don't feel hopeless. There are systems and structures and tools that can help you excel in public health and advance in your career without burning out, without feeling overwhelmed and exhausted. You just haven't learned them. They weren't taught in grad school. They're not taught at APHA. Your employer isn't teaching them. That's okay. That's why I'm here. That's why I created the Public Health Burnout Coach. That's why I coach women. That's why I teach these tools, so you can actually learn the skills you need to feel calm and grounded and get your work done without exhaustion. The biggest shift I want you to start making before we get into the 4 simple tips, and I'm going to emphasize this again, the tips are very simple, but the biggest shift I want you to start making is shifting from focusing on what's out of your control to focusing what's in your control. There's a lot of challenges out of our control in public health. Other people, policies, the funding. We maybe can advocate for changes. Maybe we can contribute to some changes, but they're not fully under our control. When we focus our time and our energy on the things we can't control, we create more exhaustion, more overwhelm, more panic, and more stress for ourselves, and it makes things a lot harder. But when we shift into focusing on the things we can control, where we have agency, when we give our time, energy, and effort there, then we actually start reducing our overwhelm and we start feeling better. So as we get into the tips, what I want you to know is they're all focused on things you can do that you have control and agency over. The second thing I want you to know is there's a number of strategies. I teach so many of them in my coaching program. I work with women for a minimum of 6 months. I could not fit in all those tips, all those skills, all those strategies in one short video. So I'm going to go over 4 today. But I want you to know there's many, many more. Some of them work for a season of your life. Some of them you'll use forever and find them really effective. Some of them maybe don't fit the exact context of your life. That's okay. Think of it as a toolbox. We don't use a hammer for every project we want to do. Same thing here. So think about which one of these will fit into your life that you feel like you can start practicing right away and see if it works for you. And if it doesn't, try another one. Number 1, you might have heard this before. And as I say this, if you feel tempted to roll your eyes, that's okay. But number 1 is keep your physical space uncluttered. Now that means your home office, your office at work, your home in general, if you can. I know it's hard if you have kids or other people you're living with. But at minimum, I want you to start practicing keeping your office, whether it's at home or work, uncluttered. Here is why. This is why this advice is given a lot. It's not just for aesthetics. Our brain is constantly scanning the environment around us. It's designed to do this. It's an evolutionary protective mechanism. Thousands of years ago, when we were hunter and gatherers, our brain needed to constantly scan for danger. So our brain is always scanning, always looking around in our environment. And if it's seeing a bunch of clutter, particularly in our office, it's going to contribute to our own overwhelm because our brain is processing that information to mean, we have so much work, we have so much to do, we're never going to get through this, we're drowning. That's what it's seeing as it looks around a cluttered office. And then listen, if you were to look around my office right now, it's a little cluttered. Like at the end of the workday today, I got to pick some stuff up. So it's not about being perfect, but it is about making a change to help you feel more calm and grounded as you get work done in the space you might spend most of your time in all week. There's a saying you might have heard, a cluttered environment, a cluttered office creates a cluttered mind. And that is true. So I want you to start small, okay? I had a colleague once, way before I started coaching. Walking into her office gave me anxiety. Just piles and piles and piles of paper everywhere. And when she started to finally declutter, she started small. She didn't try to do it all in one day, and I don't want you to either. Even if your office isn't filled pile high with papers, I want you to start small. Maybe it's starting with just cleaning your desk off. When you go to your lunch break, when you end the day, just picking up your desk, putting things where they belong, putting the pens back in their holder, putting your Post-it notes in your drawer, closing your laptop, turning it off, putting papers you do have out stacked up, even if you don't have time to file them. Start small. Then as you continue this practice, you can start building out a little bit more organization, right? Maybe it's at the end of the day, you take your papers and file it away. Maybe you put them in folders. And I want you to just keep the essential things in view. Have everything else put away in folders or in containers that they hold or in drawers. We want to remove that visual noise. So just start with 5 minutes at the end of the day. You will be shocked to see how positive an impact that's going to have on your mental load, on your cognitive load, on your overwhelm. And the next day when you go into the office, notice how much calmer you feel in your body. It might be subtle if you're not paying attention, but as you build awareness around it, you'll see walking into an office that is clean and doesn't have clutter everywhere, you're going to feel a lot calmer to start your day than if you walk in and there's stuff everywhere. Okay, tip number 2, I actually teach this as part of my email and calendar management system. I have a whole system I teach the women in my coaching program. This is one tip out of it that I want to share with you all today because it's that effective. And that's to use only one to-do list for work. Okay, so I know some of you, because this used to be me, who have an electronic to-do list and some reminders on your phone, and you leave emails unread to remind you of what you need to do, and you have Post-it notes everywhere. Remember, this used to be me. Okay, so there's no shame. That is really not effective, and it creates so much more overwhelm. It leads to things falling through cracks, forgetting things, not remembering where things are. It requires your brain to think so much more because your brain, again, is constantly trying to organize and scan the environment and figure out what to do when. And if you have a million different lists, it's trying to figure out what's going on here. And it creates a lot more exhaustion. Instead, I want you to choose one place where all your to-do items will be listed. It can be anywhere. If you want to use an old school paper list, go for it. If you want to use Google Notes, go for it. I use Asana, similar to like Monday.com, not sponsored, where you can just organize your to-do list electronically. But whatever it is, pick one place to have all your to-dos listed. And then every time you get a new task you need to add there, maybe you leave a meeting and there's a couple things you need to follow up on. Maybe you get an email and there's something you have to do. put it on that one to-do list. This allows your brain to rest because it's no longer having to constantly scan or think about what's next, what do I need to do, where am I going to find this information? Or I forget where I put that. Oh, I know there's something I need to do here with this project, but where did I write that down? No more of that. You're going to get mental rest from just having everything in one place that you know where it is and you know where to look when you need to get things done. Okay, tip number 3, I want you to start doing a 2-minute, anyone can do 2 minutes, restart at the beginning of your workday. For most of us, we get up and then we have a little hectic morning. We get up, maybe we make coffee, maybe we get a quick shower in, maybe we're getting our kids' lunches together, maybe we're rushing to the school bus stop. Maybe we're trying to make our own lunch or eat our breakfast, or we got to get out the door real quick before the commute. Or if we work from home, we're trying to get everything organized and get to work and we're running late because we hit snooze 10 times, right? Again, no shame. We're humans. This is human nature. But what that often means is we're starting the workday in a rush. We're starting the workday already feeling behind, already feeling scattered. And this does not help us feel less overwhelmed. So I want you to set a timer and do a 2-minute reset. You can do 2 minutes of just breathing. You can do 2 minutes of stretching. You could even just spend the time setting an intention. Okay, today my intention is to stay focused. Today my intention is to work at a steady pace. Spend those 2 minutes in the morning as a little transition time to really bring yourself and be centered. And you'll be shocked at how much this helps you feel more calm and grounded throughout your whole day. Okay, tip number 4. We're switching to the end of the day. You're wrapping up your day. I want you to actually close up shop. I want you to set or decide one closing ritual. You know how shop owners, maybe they own a boutique, maybe they own a restaurant, they have a whole closing up routine. Maybe they sweep the floors and mop the floors and empty the cash register and turn the close sign on and the lights off and lock the door, right? That really signals, hey, we're done with work today. One of the reasons it's so common for women in public health to feel like they're bringing their work home, even if they're not working on things, but mentally, is because they're not doing this mental shutdown from work. So a closing ritual that you do every single day is going to create this association with your brain that, okay, now we're doing this, work is done. It's kind of like if you've built a habit of brushing your teeth before bed, that when you start to brush your teeth, your brain has a signal, is like, oh, okay, this means we're going to bed, right? Our brain learns through those associations. So when you build an association of an activity, a ritual, something you do at the end of the day to signal, hey, we're done with work today, your brain's going to be triggered by that to know, okay, we're shutting down, we're not thinking about work. So again, this can be extremely simple. Maybe it's actually shutting down your computer, your laptop, actually turning it off, not just closing it, but turning it fully off. Maybe it's back to tip number 1 and you spend a minute or 5 minutes cleaning up your physical area, and you do that every day. Maybe you sit down and write tomorrow's top 3 priorities, and that's your signal of, okay, today's done, we're writing through priorities for tomorrow. Maybe you even say to yourself, okay, work's done today. I had a client I worked with, and she's built this practice of just saying, we're finishing work today, as she closed her laptop. And it really created this association with her brain that's basically was like, okay, good, we're done. Not thinking about it anymore. Your brain, like a computer, like a restaurant, needs an off switch. It needs to know, hey, we're shutting down the work mode. And this is an activity you can do to create that. Earlier, I mentioned that you can reduce your overwhelm without having to quit your job. And that's a fact. I know a lot of times when we work in public health, where there's lots of challenges out of our control, we think the only solution is to quit. Well, the good news is that's not the only solution. And in fact, if you do quit, it's not a solution at all. Because every job, public health or not, are going to have a lot of challenges. Instead, we want to focus on what's in our control and implement strategies that are evidence-based and science-backed to help us reduce our overwhelm. And this really works. As I mentioned earlier in the video, women who come through my program reduce their stress by 25%. Stop overworking. They have enough time to start training for marathons. Now, if you don't want to run a marathon, that's okay. You don't have to. Some of them have just started going to yoga or just simply taking their lunch at work. Having more time with their family, being more patient with their kids. This is all possible for you too. You don't have to quit your job. You just have to implement some of these simple and effective ways to reduce your overwhelm. Now, this is just the beginning. There's so many other things you can do to reduce your overwhelm. I'm going to be sharing more tips and more insights in future videos, like how to say no, how to delegate, how to increase your productivity. I already have some videos on how to set boundaries, how to reduce your stress in 2026. If you want to check those out, you can go ahead and click below. I'll share them so you can get more tips and insights to help you have more work-life balance. And I'd love to hear from you. If there's something particularly overwhelming in your job right now, drop in the comments. I'm happy to share my insights, my tips with you, give you some personalized advice, let me know in the comments and I'd love to support you. All right, everyone? So proud of you for being here, committing to feeling better. I know it's possible for you and I'm here to help you. So make sure you hit that subscribe button and I'll see you in the next video. Bye, everyone.